Hello, everyone. My name is McCallum. I had the privilege of conducting my practicum with Interior Health, which is one of the 5 health authorities in BC. And throughout my practicum, I worked with the Healthy Communities team on a variety of projects related to climate change and climate resiliency. But the focus of my culminating project was on the usability and public health implications of the community health and climate change maps that were recently developed for Interior Health. So the map on the left shows the regions that Interior Health covers in BC, and the map on the right shows the First Nations communities within Interior Health. And I'd like to acknowledge that the Interior region is home to 54 First Nations communities and 15 Métis chartered communities. And I'd also like to acknowledge that I'm located in Nelson, BC, on the traditional unceded territories of the Ktunaxa, Syilx, Sinixt, and Secwepemc peoples. So the issue. So extreme weather events caused by climate change are expected to increase in severity and frequency. And the direct and indirect impacts of climate change are vast and will continue to lead to injury, illness, and death. Although reducing greenhouse gases is critical, doing so will not prevent further global warming in the years to come, which is why building climate resiliency in communities is extremely important. So the health impacts from climate change are both direct, when natural hazards lead to death or injury, and indirect, when natural hazards affect the social, environmental, economic, and cultural domains that influence health. And while these impacts affect everyone, not all individuals are equally at risk, which kind of leads to the definition of climate vulnerability, which is the predisposition to be adversely affected by climate change. So the image on this slide shows some of the drivers of inequity and how the determinants of health impact community and individual health and well-being related to climate change. So climate change has significantly impacted the lives of British Columbians, and it will continue increasing the severity of climate events such as extreme heat, flooding, wildfire smoke events, extreme cold, and ozone air pollution. So in 2021 alone, we saw a number of extreme weather events significantly impact BC, which I'm sure many people here directly experienced. So there were the 2021 heat dome, which led to a 440% increase in heat-related deaths. The floods in November was one of the costliest natural disasters in BC history. This past summer was the 3rd worst wildfire season on record, which was partly due to the heat dome. And lastly, dozens of low temperature records were set across BC in December of 2021. So these events exacerbated existing inequities and affected some population groups much more severely than others. So now on to the development of these climate vulnerability maps. So through spatial analysis, various methods exist to assess vulnerabilities and map community health impacts to climate change and to climate hazards. So in response to a need to understand where vulnerabilities exist across BC, Vancouver Coastal Health and Fraser Health, 2 other BC health authorities, and the University of British Columbia created a series of climate vulnerability maps in 2021. And then recognizing the need for these maps in BC's interior, a similar set of maps were created for Interior Health, which are called the Community Health and Climate Change Maps. And this is what my culminating project was centered on. So these maps will be available through the Interior Health website via an interactive tool, which you can kind of get a sense of what that would look like with the image on the slide here. And they're intended to be used by urban planners, local governments, interested community members, and other health officials involved in climate change mitigation and adaptation. So it's important to first understand what vulnerability means in the context of these maps. So it means increased risk of negative health outcomes, and it's made up of 3 factors. So exposure, which is the likelihood that someone will actually encounter a hazard; sensitivity, which is how physiological characteristics impact one's exposure to a hazard; and adaptive capacity, which is the ability to adjust or reduce health risks. And this is where kind of the social determinants of health come in. So through inferential statistics, overall vulnerability scores, which are a combination of exposure, sensitivity, and adaptive capacity, were created for each Interior Health region. And using GIS software, a picture of vulnerabilities to 4 climate hazards across Interior Health was created. And these 4 hazards were extreme heat, flooding, wildfire smoke, and extreme cold. So I'm definitely not an expert in the technical GIS and statistical side of things regarding the development of the maps, but I focused on the communication of how these maps could actually be used. So before releasing the maps to the public, Interior Health wanted to ensure they were accompanied by adequate communication about how they could be used by local governments. And this led to the development of a communication tool to live alongside the maps, which was the focus of my project. So I started by conducting key informant interviews with individuals from Vancouver Coastal Health, urban planners, GIS specialists, and interior health team members. And findings from these interviews helped inform the goals of the communication tool, which were to provide a brief overview of the maps, communicate the public health perspectives, provide examples of their use, and inform planning and response to climate change related inequities. So this slide shows the first page of the communication tool I created, which starts by briefly outlining the background about the maps and defines the factors that make up vulnerability, which we went over, and the 4 hazards assessed. And the first page also highlights some of the limitations of the maps, which I'll talk more about in a second. But essentially, it's that the maps are based on census data, and it's the 2016 census data as of now. Vulnerabilities are complex and difficult to map, and maps usually, and in this case, represent one point in time and are inherently interpretive. And then the second page of the tool highlights some ways the maps can really get local governments thinking, planning, and collaborating. So we wanted to ensure that and emphasize collaboration with interior health so that local governments didn't feel as much like all of this climate resiliency planning was kind of being passed on to them. And while we do want to provide relevant examples to empower local governments to kind of run with this data, we also want to emphasize that collaborating with interior health is key to tackling some of these larger issues that surround community vulnerability to climate change. And lastly, after speaking with urban planners, it was deemed essential that a link to download the actual maps GIS files was included on the tool so that planners could download these and add them to their existing map layers. So the maps themselves have the potential to inform local governments and communities about their vulnerabilities to climate hazards. And they also provide opportunities to address the 4 climate hazards depicted in a number of ways. So these are just a few examples, but in terms of extreme heat, the maps could inform the development of a heat alert and response system, which is kind of an emergency response plan for heat. For regarding flooding, the maps could be used to identify where alterations to the built environment might reduce flood risk. For wildfire smoke, data from the maps could inform and strengthen emergency response procedures. And lastly, for extreme cold, the maps could help determine where to build shelters or where to target adaptation strategies for vulnerable communities. And by adequately communicating the map's uses and limitations, they're hopefully more likely to be used to their fullest potential and less likely to be misinterpreted. And then providing actionable suggestions of how they can be used can hopefully provide local governments with adaptation strategies across multiple domains, which is depicted in the image on the slide here. And then hopefully the maps will lead to the development of new partnerships with interior health and encourage the use of a climate health equity lens in future planning. So there's a few limitations. Firstly, we aren't sure exactly what the uptake will be, and it may be difficult to track how many people use the maps and download the files, and really what the impact is on climate equity. So the development of a robust evaluation plan to assess this is definitely needed. And despite sharing the limitations of the maps, they could still be misinterpreted, and they will require frequent updating and GIS maintenance to reflect up-to-date data. So given these limitations, the maps should definitely be used in conjunction with other resources and not relied on completely for the full picture of community vulnerability. And in conclusion, using spatial analysis to create climate change maps can help illustrate how one's risk to climate hazards is not just linked to their location, but to the 3 factors that make up their vulnerability. And that's sensitivity, exposure, and adaptive capacity. And by providing local governments with access to these maps and supportive communication about how they can be used, the maps can hopefully enhance conversations about climate hazards that BC faces, encourage collaboration with health authorities, and lead to more equitable support for at-risk communities. And while the maps are not perfect, they do present an estimate of climate vulnerability, but based on the best available data, they're meant to start conversations how to best prepare and adapt to climate change related hazards equitably. And I think that's one of their greatest strengths. So I'd like to thank Jenny Green, my practicum supervisor, the IH Healthy Communities team, Dr. Jaime Arredondo, Dr. Catherine Worthington, and Dr. Karen Urbanowski. And I've also just added the link to the Climate Resiliency and Planning webpage on Interior Health's website, where you can see the communication tool in action and kind of play around with the maps a little bit if you want to check them out. So thank you very much, and I look forward to your questions.